Hi, my name is Morgan. I'm going to be your nurse today. We're going to do some trach care and trach suctioning. Can I have you verify your name and date of birth? Thank you. So I'm going to start opening disinfecting wipes, dropping it, and then cleaning off my surface area. And then I'm going to clean my hands. Oh, I used a lot of that hand sanitizer there. It's going to take a minute to dry. If we can just be patient with each other. Okay. All right. So we're going to put on our non-sterile gloves. And then I'm going to start by turning on my machine for the tubing, setting it to medium, and testing the patency of the tubing. And I'll make sure that I have an ambu bag right next to my patient while we do this. And I'm going to monitor heart rate, respiratory rate, and pulse ox. So now that I've done that, I'm going to keep it here at a comfortable place. And then I'm going to open this. I'm going to get our suction kit going. So now I'm going to clean my hands again because we're going to don sterile gloves. Whew, it's really liquidy hand sanitizer. So I'm going to reach in and grab out the sterile gloves and set them aside and use another pair because the sterile gloves are very difficult for me. I realize that I know I've touched something that's non-sterile. I need to clean my hands again before starting to don my sterile gloves. And I believe I should be wearing a mask. And again, because I touched something before I donned the sterile gloves. Okay, all right. So I'm going to pinch here. Oh, yeah, I should have stepped back. So now we're going to take out our tubing. I'm going to wrap it tightly this way in my done hand. And then I'm going to take out my box. And then I'm going to connect the tubing, making sure that my right hand and left glove don't touch. And so for this demonstration, I'm going to keep this part in my left hand, hold it here, and then put with my left non-sterile hand water in the container. And then there would be tubing here, which I'm holding on to. And then I'm going to test the patency of the tubing. And I'm going to ask the patient to take a few deep breaths. And then this would be connected to a tubing, so I'm going to use my non-sterile hand. And I'm going to go right into the catheter, 3 to 4 inches. And then use the button and slowly, intermittently pull it out. And I'm going to clean my tubing again while keeping this on my patient. And then I'm going to clean it again. Ask the patient to take a few deep breaths for me again. Use my non-sterile hand to move this. Again, insert 3 to 4 inches, intermittently suction on the way out. And then clean my tubing. And then I'm going to put all of this, all my supplies, glove to glove, and move it out of the way. All right, now we're getting to the trach care portion. So I'm gonna move my supplies here, and then I'm again gonna wash my hands. Get it nice and clean. Patient is doing well, comfortable. Sorry, this cannula isn't staying very well. And now we're going to don sterile gloves so that I can remove the cannula. Okay, so I'm going to use my left hand and I'm going to pull out the cannula and throw it away. And I'm going to clean my hands again, and we're going to open the tracheostomy care tray. Okay. Tight. Step back. Oh, oh no. Oh, Well, ordinarily I would start over with a fresh set of gloves, but I don't have them right now, so I would take a new pair of sterile gloves and don them. Okay. Please. Can't get it open. I can't escape. Okay.
Great.
So I'm gonna take the tissue and inspect it for color. It can be disposed of. I'm gonna take the clean cannula and slowly insert it in until I hear a click. Make sure the patient is oxygenated. Then I'm gonna take these and I'm gonna hold the base plate and swab up to down. Up to down. Underneath, up to down. Other side, up to down. And then I'm going to take in the saline, up to down, up to down, underneath, up to down, underneath, up to down. And then I'm going to take gauze, make sure the patient has enough time if they need it. This up. And then I'm going to clean and fold the different areas of gauze. And then replace the piece underneath. And now I'm going to take the trach string. I would put it in one side of the care. And I'm going to pull my patient's head up and I'm going to check the skin to make sure there's no damage or tissue breakdown. And then tie it with a box tie, making sure that 2 fingers fit underneath and cut off any old. And then I'll take all of these items off of the patient. And then glove in glove removal and wash my hands. And now we've completed or tracheostomy, suctioning, and care.